Hi, this is Duncan Ferguson. We're going to continue our discussion of glucocorticoid therapy in small animal practice with this Part 2 module, which is going to focus on the side effects of glucocorticoids, complications they can cause, and a little bit about specifics about pharmaceutics. This slide summarizes the complications of glucocorticoid therapy, the side effects, and many of these hopefully you can derive from your understanding of the physiology or the pharmacology that we discussed in Unit 1. So the main ones that we focus on are things like the exacerbation of glucose metabolism through the liver, basically that can exacerbate diabetes, the polyuria, the polydipsia, that's associated with ADH suppression, and hypertension, that's due to sodium retention. One of the things that is often discussed, a little bit difficult to prove, is that there are behavioral changes associated with glucocorticoid administration. This is something certainly that's described in people, sort of that steroid mania. And there seems to be reasonably good evidence that steroids can decrease the threshold for seizures, meaning that take an animal prone to seizures, put them on glucocorticoids, and they might then develop them. Of course, the development of GI problems is associated from conditions as wide-ranging as it's been incriminated in pancreatitis, although the evidence for that isn't often very strong. Certainly we know we get a steroid hepatopathy. We know that they can cause ulceration, particularly in the upper intestine, the duodenum, and they can lead to diarrhea. Metabolically, suppression of growth hormone leads to growth retardation and increased catabolism at high doses. An animal that has significant amount of gluconeogenesis going on will have muscle wasting, and that's typical of a cushingoid patient, so that myopathy that occurs, and in the longer term you may even have some degree of osteoporosis, as steroids tend to inhibit the action of vitamin D. In the skin, we know that glucocorticoids can reduce the ability for a wound to heal because of the tendency to increase collagenase. We know there's thinning of the skin. We can occasionally get this pathologic calcinosis cutis. And of course, the big thing we often worry about is the immunologic effects. These are due to mainly cell suppression of cell-mediated immunity, and that is associated with the possibility of exacerbating infectious disease. In this slide we have a picture of a dog who was on chronic glucocorticoids, and you can see in the left-hand panel he has this sort of typical pot-bellied appearance. If you were to look really closely at the blood vessels, you can see them through the skin, very thin skin. And of course the bilateral symmetrical alopecia that's associated with Cushing's disease and other endocrine disorders such as hypothyroidism and Sertoli cell tumors. In the same dog, a veterinarian had tried to suture up a wound that this animal developed following a procedure and was not able to lead to healing of this chronic ulcer until the animal was removed from glucocorticoids. And again, because of the effects on collagen synthesis, glucocorticoids can tend to reduce the normal healing process. But once this animal was removed, or glucocorticoids were removed from the animal, over time the animal healed, and you can see that the healing has progressed fairly nicely. Glucocorticoids can cause a form of micronodular cirrhosis of the liver. And of course we know that increase in the glucocorticoid-specific alkaline phosphatase can occur as an earlier indication of an effect of glucocorticoids on the liver. And glucocorticoids tend to increase glycogen deposition in the liver. The cat's a little bit of a funny species to deal with glucocorticoids. There's been some talk about it, and we'll talk about it later. They're slightly less sensitive to glucocorticoids, and their clinical signs with at least iatrogenic hyperadrenocorticism were summarized in this table from a paper in 2008. You can see hair loss is pretty common, but thin and inelastic skin is pretty common, and actually tearing of skin is not uncommon at all. A few have the ears will curl up, and bruising or just a general poor hair coat can be seen. So let's turn our attention a little bit to our glucocorticoid pharmaceutics, and the main reason to do this is to appreciate the very fine differences that occur in this essentially cholesterol structure that you're seeing here, and some of the modifications that have been done by drug companies. The areas that are represented by purple, red, and blue are those that impact the sort of what I'll call the steroid base activity, the tendency to be glucocorticoid, the tendency to be long-acting versus short-acting, the tendency to have mineralocorticoid activity. Whereas the yellow section here is where esters can be added on, and those esters onto this alcohol will tend to create a longer-acting or depot preparation. The steroid base is that, as I said, that determines the anti-inflammatory potency, the mineralocorticoid potency, and the duration of action once it gets there. So the tightness of binding, for example, to the nuclear receptor. That's all determined by the general steroid structure, the base. This table is drawn from it's seen in most pharmacology textbooks, and I want to just illustrate that it's meant to give a relative idea of how potent these glucocorticoids, the sort of synthetic ones that we see down here, including cortisone, relative to the natural glucocorticoid hydrocortisone or cortisol. And so one of the things that we compare these based on is glucocorticoid potency and their tendency for sodium retention or mineralocorticoid potency. The duration of action is impacted, is also shown here, so short-acting, intermediate-acting, and long-acting, and that's mostly important. So if you look at this column, the long-acting, for example, are not very useful for alternate day therapy, which we'll talk about later, because they suppress the hypothalamic-pituitary adrenal axis for well beyond, usually beyond 2 days. And so this is, these sorts of tables are all commonly shown, and the next slide will sort of give you the idea where this kind of data comes from. So just to make a point, these potencies are derived from experiments in one human being, and so wrong species for those who are treating animal patients, but we should therefore only use as relative guidelines. So it's likely that we can talk about prednisolone being 4 to 5 times more potent than hydrocortisone, for example. So if we want to switch from one compound to the other, we can use these potency guidelines to make a switch in our actual dosage. So what's the impact of the formulation? The formulation in its tendency to suppress the HPA axis is going to be the combination of the dose, so higher dose tends to suppress more, the potency of the base, that is, does it act longer than 24 hours, for example, and as we'll talk about, the development of any formulation that would be a depot preparation. So those obviously are going to be trickling out hormone from a subcutaneous or intramuscular depot for a longer period of time, and they will suppress the HPA axis longer because of it. So as an example, these are all long-acting injectable products. that give you an idea that when you add the esters, such as acetate or acetonide, you can get an extension of that product, and therefore, but basically what's happening is you inject it under the skin or in the muscle, and then esterases break that ester bond and trickle it out into the bloodstream. And so you have to take this into consideration that when you give a product like this, and we have reasons to do it, give it to a cat that's a little fractious, for example, you are going to live with that drug being in the animal, and if the animal gets an infection, you're going to have to manage it with glucocorticoids on board. These dosages, or any dosage that we will talk about, need to be tailored to the individual and to the effect. And the problem with this is once you inject a hormone like glucocorticoids, and they have a long-acting formulation, they're difficult to reverse.